Welcome, and thank you for joining us today live, or if you're on the recording for episode 17 of Dr. Jeff Talks About Sex and Intimacy, Understanding Gender, Sexual Orientation, and Expression in Intimacy. I can't tell you how much it means to me that you took time out of your busy schedule to join us to learn about this topic. Welcome. We are on social media. We're on all your favorite social media sites, on Facebook, on YouTube, on X, you name it, whatever the social media you like, we should be out there. We are still looking for 100 followers on Facebook so we can stream live. So please, if you are a Facebook person, please follow us. We appreciate that very much. If you just hit follow and follow us, that'd be great. If you want to learn more, go to the website. You can watch all of our amazing episodes. There's so many good guests that we've had on. You can watch those past episodes. You can pull up the calendar and see what's coming up each week. We have amazing people coming up in the next couple months. We are booked out through July and have some great guests. So please go to the website to learn more about that. Also, you can listen to us wherever you are. We are in your car, while you're working out, on Spotify, on Amazon Music, iHeartRadio. So please tune in and listen. And we're so glad to be on those sites. I hope you know that you are most welcome. Everyone is welcome here. So whatever your sexual orientation, whatever your gender identity and or relationship style, you are very welcome here to learn and listen and be seen, heard, and valued. Now, the goal of the podcast is pretty simple. It's really just to empower and enlighten you with evidence-based information. What does that mean? That means scientific information. Research has shown these things to be true, that you need to improve your sexual health and deepen your relationships. This evening, we're going to be talking about, I want you to think a little bit about understanding ourselves and those we love through the lens of gender, sexual orientation, and expression. It's an essential part of building deeper intimacy, empathy, and connection. Now, in today's episode, we explore the beautiful diversity of human experience and how our identities, who we see ourselves as, shape the way we give and receive love. Whatever kind of journey you're on of self-discovery, or if you're just supporting a partner or simply wanting to grow in your own awareness, this conversation invites us to let go of rigid definitions and open ourselves to authentic, affirming intimacy. Intimacy flourishes when we feel seen, when we feel heard, and when we feel valued for who we truly are. This evening, I would like to just give you a little heads up of what's going on. Every week is interesting. Life is always a mystery, and this is no different. Our guest, Lisa Katona, was amazing, and we were really excited to have her, but she had a family emergency need that she is dealing with. So our thoughts and prayers go out to her, and she will not be able to join us because she has very important things to attend to with some family things that need to be dealt with. But having said that, the plan is hopefully Alicia Williams will be joining us, and she stepped in at the last minute. She is with patients, so she will be joining us shortly. But just a little bit, Alicia Williams is a compassionate licensed professional counselor and a certified sex therapist. She is very passionate about empowering her clients to live more connected and authentic lives. Love that. Alicia brings warmth, she brings insight and practical tools to her therapeutic relationship with clients. She is particularly committed, and that's why she's going to hopefully be joining us this evening, to supporting individuals from diverse backgrounds, including LGBTQIA+ communities. And she approaches all of her work as I do as well, through an inclusive and culturally sensitive lens. So I'm hoping she will be joining us shortly, but the bottom line is she is with her clients right now, and when she is done, she will probably pop in and join us here.
Hey, Jeff, Alicia's on the show with us.
Awesome. Welcome, Alicia. I'm so glad you're here.
Unmute myself. Hi, how's everyone doing tonight?
Well, Vic and I are great, and I'm so glad you made it. And thank you for fitting us in your busy schedule at the very last minute and pinch hitting for us this evening on this really important topic. I so appreciate you being here.
You are so welcome. I'm looking forward to a good conversation.
Excellent. My plan is I'm going to have Vic pull up the presentation and we will both be there so we can both comment as we move through the slides.
Perfect.
Because we both have expertise and then we can dialogue and have fun talking about it. So let's pull
Absolutely.
up the presentation and let's go. Great. We're both here and we're ready to go. So yes, we are unpacking understanding gender, sexual orientation and expression and intimacy. You've probably seen and heard some of the different terminology, maybe lived some of it, but often people feel uncomfortable and aren't really sure of it all. So we're hoping to really help you understand a little bit more about it this evening. So let's just start with sexual rights. And this is not a complete list, but I wanted to just outline, this is from the World Health Organization. And because we want to be, this is all about everyone has the right to the highest attainable standard of sexual and reproductive health services. Everybody. In addition, we all have a right to privacy. That's very important because when we're talking about these really personal things, it's already difficult to talk about them, but we want to know that our privacy is being maintained. We have a right to fulfill and express sexuality in the way that's comfortable and meaningful for us. We have a right to enjoy sexual health, a right to information and education. And that's what we are all about here on this podcast. And so that's definitely what we're trying to do, empower you with information this evening and always when we do the podcast. And you have rights to equality and non-discrimination, to not be discriminated against because of the way you express yourself. So let's jump right into gender. You know, we have these constructs, we have these concepts in culture, and they get changed and sometimes misconstrued. But gender is often categorized as these three categories, most often male, female, or non-binary, but there can be other categories, which we'll discuss this evening. Often it is defined by social constructs or norms, behaviors, and roles. But the truth is that it is deeply personal and it exists beyond traditional categories. So these categories don't really define who we are in terms of gender. And sometimes we don't feel like we fit into any of those categories. What is gender identity? Gender identity is one's own internal sense of their self, their gender, whether that's man, woman, neither, both, all, any of the above. That's gender identity. So that's the internal sense of self and gender. Gender expression is how a person presents gender outwardly through behaviors, through clothing, through voice, or other perceived characteristics. And that's important to understand that. Gender fluid means expression of a gender that it's not fixed. It can change over time, and for that person, it may change throughout their life course at any time. So it can be fluid. Alicia, did you want to say something?
No, I think you're doing a lovely job of kind of representing the different options. You know, I recognize that by nature, humans like to categorize things for efficiency and for understanding. And so, you know, I sometimes say to people when they come to my office, you can have a seat on the sofa. Well, they know what I'm talking about because even though they've never seen this sofa before, they have an idea of what a sofa is, and this meets the criterion, right?
Mm-hmm.
And I think one of the struggles that we have related to gender this is a particular moment where it's a really relevant feature in our culture, but for all time, there have been expectations of what gender expression
Mhm.
is. If you look at paintings from 200 years ago, right, and the dress or the mannerism or the way of gender expression, and now things evolve and we have very clear ideas about what we think masculine and feminine is. As though that is a fixed trait. Boys always like blue and girls always like pink and girls wear dresses and right? And the reality is that those are in large part social constructs because culturally, um, different eras, different parts of the world, people express gender in ways that feel in line with their cultural expectations or their own personal beliefs that might look different, even contemporaneously, right? In the same era from what might be happening in another place. And so I think when we get stuck in these choices, we really limit ourselves to feel like there's any one way to be gendered.
Such good points. And even sometimes when we label it, we're almost boxing ourselves in. When we label ourselves male, female, binary, whatever, it's almost like it already sets parameters around what that could or may mean, right?
Sure. I'll ask people sometimes, think of every possible definition, right? Or stereotype about a gender. And then imagine, do you mark every one of those boxes? Does every single thing related to being female or being feminine or being male or masculine, do you embody all of those? And no one ever says yes, right? Because it's a huge range. And so that sometimes gives people who have a hard time kind of expanding outside of, well, there are only two genders, or this is the right way or the wrong way, to say, I don't really want anyone to dictate what, even if I identify in a cis way with the gender that I was assigned, even that I might not replicate all of the characteristics of that gender identity. And so in that way, we can certainly relate to people who say, my body appears this way, but I identify more with characteristics, right? Or maybe I have a diverse set of characteristics that kind of fall into all the boxes. In ways that can be really liberating. I think we often think about these gender conversations related to people who don't necessarily fit in the box, which I think is a valuable, important conversation, life-saving conversation to be having for people to be inclusive. But I also like to just ask people who do identify as cis to consider the ways in which they benefit from some liberty, right? To pick and choose what parts of gender expression feel authentic to them.
Definitely. My Reiki master, Neil, is always saying to me, we're working more on yin today or yang. So very much in the Eastern world, we're always thinking yin yang, and it's a balance. And there's some of all those things there, right?
Sure.
So I think it's categories can help us to understand things better, but sometimes they can box us in too. So labels and categories. So just maybe everybody out there, think a little bit beyond labels and categories, even to say, for example, I'm a father, but does that encompass and define everything that I am? No. So what word can really encompass the incredible mystery and awe of the human being? Not much. So you got to be careful a little bit with words. And as we're talking about, and you did an incredible segue into this, thank you, Elisa. She was talking about cis, and you'll hear cis or cisgender. Sometimes you'll hear transgender or trans. Those are used interchangeably. So if you're like, what does she mean, cis? First off, don't be embarrassed. That's why everybody's here. We're here to learn. And if you have questions, you can put them in the chat as well. But cisgender is a person whose gender identity matches the sex they were assigned to at birth. So when you hear us talking about cis or cisgender, that's what we mean. And so, for example, my pronouns, and we'll get to those in a minute, are he, him, his, and I am a cis male. And But again, is that everything I am? No, I think we all have feminine and masculine qualities, but these are some terminology that we just want to kind of clear up. Does it mean these definitions are hard facts? They're absolute? No, but this is what we're talking about when we say those things. And when we talk about a transgender, then that's a person whose gender identity differs from the sex they were assigned at birth. And a non-binary person is a gender identity that falls outside of the traditional male-female binary. So it's sort of dichotomous. You have to be male, you have to be female. It's binary. And so non-binary means, no, I don't really see myself as male or female. And then gender queer, and sometimes you'll hear the term queer or gender queer. And the LGBTQ community has reclaimed that word queer, but be careful because some people may still find that word upsetting or offensive because it was used as a negative derogatory thing in the past, but they reclaim the power of that term. And so it reminds me, and I know, Alicia, you're always cognizant of this, we don't just jump to terms, or I try not to assume anything, anything at all, because I go with what people tell me. What do you prefer? Are there different, how do you identify? What pronouns do you want? There's no greater gift than you can give someone to go with what they're comfortable with, and make sure you're using, and everyone around you is using those particular terminologies that are comfortable. So genderqueer is a term that encompasses a range of gender identities and expressions that are outside of traditional male-female binary, again. And so that's important. And you may hear genderqueer or queer, either one. Gender fluid is that identity that can fluctuate. It can change over time. It can change. My wife always says it's a woman's prerogative to change her mind and change how she feels about things. And I think all of us can change how we feel about things. So gender fluid means that it's in flux. It can change. And then agender means a person who doesn't identify with any gender. When you see an A before a word like gender and some of these terms we're talking about, it usually means they don't identify with any of that. Asexual means they're not sexual. The A before it sort of says they don't identify a gender or as sexual, for example. Pangender, then, that's different. And think pan. What does that make you think? A person who identifies with all genders. Mm-hmm. A bigender is a person who identifies with both male and female genders. Now, intersex is a person born with characteristics that don't fit typical definitions of male or female. They may be born with male and female parts both. And so that is another terminology. And then questioning is a person who's just exploring their gender identity or their sexual orientation. Alicia, what would you like to add anything to? Sometimes these terms can get confounding, and I know some of my friends are overwhelmed by them. But I think it's important for us to at least kind of define that language and talk about it.
Sure. One of the things I think is really useful is to recognize that a range of options exist. For example, on this list, you might feel like, well, some of these feel similar, right? Or repetitive. Do we need all of these terms for people who are not strictly, kind of identifying one gender or the other? And the reality is that we're talking about identity, which is a deeply personal thing. And so, I know, for example, women who like to call their lady friends girls, and other women who really hate to be referred to as the term girls, right? That might be an example of something that feels good to one person but doesn't resonate with someone else, right? So in this way, thinking about if, non-binary feels like a term that when you read it, you go, that really sort of encapsulates, that feels like I put it on and it fits me. Whereas to say, gender fluid or pangender feels a little bit more like descriptive of my own personal experience. One of the things I think people can get caught in is trying to come up with a static
Mm,
definition of these things instead of affording people the opportunity to settle on something that feels like a home for them. And then
mm,
just being curious about that. Tell me how that resonates with you. What does that mean for you? How can I, most connect with the person that you are? You talked about earlier just checking in with people. It's literally the easiest thing in the world to say to somebody, how do you like to be referred, right? What is the thing that makes you feel most seen? How can, you know, if somebody was given a very formal name and they like to go by, a nickname, it's the easiest thing in the world to say, oh, well, that's Skippy, right? They just like being called Skippy, and we all have cousins and family members, and we know what that's like. So I like the way you're describing this and making it very accessible to people to say it doesn't have to be a clinical definition or meet some kind of rigid, um, checkpoint or a qualification. It can
mm.
really be something that someone is trying to give you as an invitation into what
Yes.
they know about themselves, right?
I love
And
that.
isn't that a beautiful thing?
That is such a great, that was just really well articulated. I love that. Definitely. And you know what's really crazy, Alicia, is this is not a comprehensive list. There are many more terms out there. They start with A's and they go on and on and on.
I
So,
feel like I do my best to keep up with things. And, people come to my office because I treat kinky people. I treat people in the poly and non-monogamous community. I certainly treat people of a wide range of identities. And even though I feel like I try and stay up, people will give, or, and also young people who have new slang just for life in general. And you're always hearing new terms. And I have no ego about saying, what a wonderful word. Help me understand what that means to you, right?
mhm,
How does
mhm,
that resonate for you? How does that articulate your experience in a way that other things have not? It's like
mhm.
a few years ago when everyone was doing the Enneagram, right? And
Yes.
I didn't know much about it. And people would come in and they would say, well, I'm a 7 and he's a
Mhm,
4. And
mhm,
because I'm no Enneagram expert, I would, and instead of saying, I don't believe in that, or that's not important to me, or be dismissive about it, I would say, and what does being a 7 mean to you?
mhm,
Right? What part of that do you most identify with? And
mhm.
how is him being a 4 or them, having a different sort of point on that scale, impact your life? There's so much we can learn from just being curious about other people's knowledge of themselves. Whereas wanting to put people in the box is us taking our knowledge based on how they look or what their name is, and then putting that on them. And some
Mm,
of the violence or harm comes from, I think, our discomfort with having misunderstood that. And we want to alleviate our own discomfort by putting them back in a box that says, no, that's not in alignment with what I thought should be happening. So let me change it.
mm. But having them speak to it, I love that beautiful invitation into in like a window into who they are and how they
Yeah.
see themselves,
Yeah.
letting them describe how they see themselves. So this is different from, and I want to warn you a little bit about this. It's not necessarily this person's job to teach you terminologies,
Right.
teach you about all of this stuff. That's not what they're there for necessarily in your life. They're there to be seen, heard, and valued by you. And so I love the idea of that is a beautiful invitation into how they see themselves.
Right.
And it's just it's really
I
good.
like that you pointed that out because I will often say to people, what would you like me to know about that?
Hmm.
Um, and if there's some like, I'd rather you know that on your own or take responsibility for being curious. I'm certainly willing to take responsibility for that, but I want to be open to whatever someone else might want to share because you're right. I think a lot of people take on a lot of responsibility for educating the people around them, and it can get exhausting. And quite
Hmm.
honestly, it may not always feel safe. They may not
Hmm.
know what they can share and with whom, right? And so
Hmm.
just letting people know I'm open to hearing and what you feel comfortable with when you feel comfortable
Hmm.
can be really important to people.
Definitely. Oh, let's talk a little bit about pronouns as well. And I know people sometimes can be confused about these too. So we have the masculine pronouns of he, him, his, the feminine pronouns of she, her, hers, the neutral pronouns. And these are the plural type neutral pronouns first, they, them, theirs. And I know some people are like, but those are plural. They're not always understanding. And so if you're wondering, well, why are they plural? They're plural because they're non-binary. They include both male and female, and so they're a more inclusive way. I know it can be confusing because it feels like you're speaking in the plural, and you are. And then there's z, zer, ziz. There's z, her, hers, and z, zer, zers. So these are neutral pronouns, and really it's just about what, besides their name, are there pronouns that are comfortable for this person you care about, this person you want in your life, this person that you've met.
Yeah. I think that was a lovely way of describing it. I had someone say to me, people can't wrap their brain around a plural for an individual, but if you identify with more than one gender, you feel a little bit like a plural, right? Sort of like I contain multitudes, I am multiple things at the same time. But whatever way you describe it, just again, recognizing that a little bit of effort to to connect with a person around a way that they feel comfortable. This often gets expanded to things like ma'am and sir, right? Which can feel really sort of triggering or upsetting to people that don't identify with those honorifics. And so thinking about what are the ways in which we connect with people, it's, one of the reasons why we can say folks or gang, or right, instead of kind of using gendered language when
The
we're talking to
guys,
groups of
the
people.
gals.
Yeah.
Mhm.
Ladies and gentlemen, right? And
Mhm.
things that might make people feel a little bit less included in the
Mhm. Mhm.
conversation.
No, very good. And so, yes. And then if you think about, have you ever felt like a plural? Think about it. Like you're at work and you're dealing with your clinic and you're doing your different things. And then but this was the old days when my kids were little. The dean of students calls me from the high school. And so now I'm plural because I'm like dealing with my clinic, but I'm also dealing with my parenthood role. So I think at some point, all of us can identify with feeling more than one thing or more than
Sure.
one category. And that's all it's about. And so, and what's comfortable for that person. Moving on to what is sexual orientation? So a couple definitions that I found out there that I thought were interesting. The enduring pattern of an individual's emotional, sexual, and or romantic attraction. I also found that, of course, it's multidimensional and it's a multidimensional construct, and it encompasses, again, those words: emotional, romantic, and sexual attraction, identity, and behaviors. So that's sexual orientation. We could think of it simply as the genders of people to whom we are attracted and physically and romantically to. That's a little bit simpler way to think about it. And it could include more than one gender. So it may be gender or genders, as we said earlier.
For sure. A couple of things there. You're exactly right that people can see themselves as exclusively attracted to one gender. People can see themselves as attracted to two genders. People can see themselves attracted exclusively to people who are outside of the gender construct, right? Or binary. And again, those things can change over time. There are people who are attracted to specifically individuals, right? Characteristics in another person, regardless of gender, right? There's a charming saying that goes, hearts, not parts, right? I'm attracted to people and I'm less concerned, like the genitals aren't the first thing that dictate whether or not I'm attracted.
Right.
And if I find the person interesting, then whatever else is going on. And I also like to point out to people that sexual orientation and romantic orientation aren't always aligned. So there are people who might have primary sexual attraction to one particular gender or category of people, and have a romantic affiliation to someone of a different category.
Mhm.
Now, that may not be the most common sort of manifestation, but it can be confusing for my clients when they come in and they say, I really feel connected to this person, but I have a hard time being sexually attractive. And I find myself leaning in the direction of sexual connection with this category of person, but I don't want to have a romantic or pair bond with them. And it just offers up, we're endlessly diverse and
Mhm.
interesting, and we have such capacity. And when we get out of these boxes, we allow ourselves to see all the, all the beautiful options that are out there.
Gosh, yes. And we do just the label. The minute you label it a bird or a whatever, it boxes it in. The
Mhm.
minute we're labeled with anything, it boxes us in too. So it's just thinking broader, thinking, and like you said, the miraculous diversity. It's amazing. And so love is love. Love is love, and it's astounding, and it's a mystery, and it's so many things. And you love who you love, and you fall.
Mhm.
Most of you out there could say, sometimes you may fall in love with a person that it's not the greatest thing in your life that this happened. It may cause you a lot of difficulty and trauma, but you love who you love, and it does happen that way. And I love that, hearts rather than parts. I think that's a
Mhm.
good way to think about it. So that's a little on sexual orientation. So I just threw out there some of the different, and there is our exhaustive lists of this. These again are just the things you'll see on most people's lists.
Mhm.
And so we have heterosexual, lesbian or gay, bisexual, queer, asexual, fluid, pansexual, and a myriad of other sexual
Mhm.
orientations. I know in my clinic, Alicia, and it sounds like you do the same. I say, well, first off, especially when I'm treating sexual dysfunction in a particular patient, I always invite partners to be there for and to be included in this. And I'll say to them, if you have a partner, and we really encourage you to bring your partner or partners, because I
Mhm.
have people who have partners. I
Sure.
had these three men who had a lovely relationship. They all were together. I'm like, if you all get along and you're comfortable, I would love to have you all in my clinic to work on this together. And
Right.
it was great. So everybody's different, and what works for one person, you may be like, that would never work for me. It's okay. It doesn't have to
Mhm.
work for you, you know. So I think when we think about the sexual orientation, and especially the fluidity of it, certainly with the bisexual person or the fluid, or as someone who identifies as queer, who's not putting themselves in a category or maybe
Mhm.
questioning.
Mhm.
um,
I think it's worth mentioning, because there's so much complexity, right, around acceptability. Things, certainly expand and contract. We're seeing that in our culture right now. Personal sort of willingness or self-awareness, right, around kind of complex sexual orientation issues. But I remind my clients all the time, you can have an identity that you don't act on.
mm,
So you can be a bisexual person. You can know in your heart, in your soul, that you are a person that has attraction to and capacity for interest in people of, male and female gender, and be a monogamously married heterosexual person, right, in a heterosexual functioning marriage, who never acts on that, but still can adopt a bisexual identity because you know that about yourself,
mhm.
right?
Yep.
You can have been in a relationship with someone of the same or the opposite or another gender, and then choose at some point to be in a different type of relationship. And that does not negate the previous type of identity that you experience. And I think
Mm,
for a lot of people that can feel really liberating, right? Well, can I claim uh, lesbian or gay or heterosexual or bisexual or queer if I'm not engaging in a particular identity or relationship that identifies with that in this moment. Your identity exists separate from behavior.
Mm-hmm.
Right? Who you are and what you do are sometimes the same thing, but sometimes they are not.
Definitely.
And that can feel really useful. My good friend and colleague Joe Court talks a lot about heterosexual men who have sex with other men and the complex reasons for doing that. And they don't identify as gay, but they have these sexual experiences. That's only one way that sort of sexual expression can differ from what your personal identity or orientation is.
Mm.
And I think it's one of the ways that in our practices in working with people or in our communities or with our family members or friends, that we can hold, again, more curiosity and not judgment. Well, that doesn't count because you're not doing this, right?
Mm-hmm.
Instead of, I can hold that is your identity, even if your behavior in this moment might be different than that.
So true. And that's why in the beginning we talked about expression versus identity. And I too absolutely have men and women in my practice like that who definitely identify as a heterosexual, but they express homosexual behaviors and they enjoy that.
Right.
But they are very adamant that they identify this way, and I am completely accepting of that. I
Sure.
think it's so true. So again, all these things, they're not as rigid as you think for most of us because we're miraculous and we're so diverse and different. Sometimes even ourselves changing. So I think of this client that I was so proud of her. I admire her so much. She's such a hero and such a great person. And she finally came to the conclusion. She said, Dr. Albaugh, I feel like I am asexual. And I've had clients definitely tell me that in the past, but I've come to terms with that and I'm okay with that identity. And but again, does that mean whoever does that or whatever person says that they may never express sexual things and still consider themselves as identified as asexual? Yes. So
Sure.
there is some fluidity.
But there can be people who identify as asexual and they're in a partnership and they even engage in sexual behavior, right? But it doesn't negate their identity as an asexual person. And part of our job, as health providers, medical providers, mental health providers, or like I said, even people who might be watching this who are investigating these things for themselves or for some loved one or person in their life, best thing that we can do is just be curious and
Mm.
supportive of someone else's experience rather than, again, putting them into a box and negating what they know to be true about themselves.
Mm.
The knowledge is there. It's the willingness to express it because of fear of consequence, right? Personal shame, rejection, or judgment from someone else. And we can't do all of that work for other people, but we can remove as many of those barriers as possible, right? You're safe with me.
I think two highly undervalued characteristics that I think are so valuable are curiosity, as you said, and humility. I think
Yeah.
certainty is a real problem, and we see a lot of that in our world now. How is there room for mystery, and is there room for learning when certainty is always the way? I know this is the only way. This is right.
Right.
And this is 100% right, which means you're 100% wrong.
Mhm.
Whereas if we have the curiosity about each other, whatever that subject matter may be, that curiosity and that openness and that humility to know. I love when people talk about the more I learn, the more I know I don't know.
Right. That's exactly right.
Right? So it's so true. But great. So how do these identities influence intimacy, and what do they have to do with intimacy, that deep connection, that communication on all levels? Well, first, you have heard us talk about safety. Safety is really important, and affirmation, feeling like you're acknowledged. It's the critical importance of feeling seen and respected and acknowledged for who you truly are in an intimate relationship. That creates safety. Communication is key. open, non-judgmental conversations about identity, exploring and needs. And we need support and deeper connection. It builds support and deeper connection. When I feel I can say, I just don't know. I don't know where I fall into these categories. None of them. I mean, like, I love some of the Enneagram stuff, and I did some of it, and I'm just like, I don't know what I am. I'm not sure what number. I think I'm 3 different numbers, and so
Sure.
and it's okay to be in that place. You don't have to categorize yourself. It's okay. So communication is important. And then barriers, some of the barriers are shame is a universal human experience. I've never met a client, and I myself do shame work all the time. Brene Brown, people who've heard me before know I am a huge fan, because I think there's a lot of work. All of us internalize shame. And we're all afraid of rejection. We all have some sort of imposter syndrome. We feel societal pressures and misconceptions within relationships. And so those are the barriers that keep us from being. I loved in the intro and the things that I put together about you when you came in at the last minute and helped me with this, because you help people to be more of their authentic self, which I think is just such an important thing. Really being able to show up as who you really are. And I think that can happen when we feel safe and affirmed.
Mm-hmm. I think you're exactly right. And, if any of us think that we're not going through life with a little bit of a mask, right, or a little bit of a kind of code switching, or right, adapting to the group that we're with, we'd be fooling ourselves. We all adapt a little bit to different circumstances. But I think the goal is to do that within a range that doesn't stray too far from what feels like the authentic nature of who you are. It's not out of integrity, right? You're sort of not so far from that you're behaving in ways that feel disconnected from your own value system. And for people with marginalized identities, there's just an inherent sense of lack of safety for being your true self, right? And one of the goals, I think, of this conversations like this, is not just to speak to the people in the communities that might be experiencing these things, which is super important, but to speak to people who relate to people, right? Whether it's you're a clerk at a store and someone comes in and, you're sort of like, who is this? What is this person? I can't quite figure out what's going on here. Encounter someone on a date or in a work situation and wonder kind of, who are they? What are they expecting? If you have just an inherent sense of human dignity, right, and a willingness to meet people for who they actually are and not who you need them to be, you instantly form a more safe space, right? And if we're talking about like intimacy, true authentic communication, certainly sexual or physical intimacy, we need to feel safe for that, right? So these kinds of conversations are certainly about the robustness, the aliveness of life, more pleasure, more fullness, right? More joy. They're also just about literal survival. We know that people who have understanding, supportive connections with people in the world, who are safe and free to be who they really are, thrive. They experience less suicidality, they experience less substance abuse, they experience less violence, right? That the things that we are doing here, these conversations, are actually harm reduction. And that's on all of us. So anytime I have a conversation with people and they say, well, that's not me, or that's not my partner or my kid, that's no one in my personal life. And I'm like, that's your world. And your job as a decent person in the world, right, who wants to create safety, right? If you believe in freedom, this is freedom for everybody, freedom to be who you need to be in order to be in the world in a way that feels safe. The saying, rising tide lifts all boats. The better we all do, the better we all do. And these kinds of conversations offer us all an opportunity to say, where are my biases, right? Where are the places where judgment sort of leads the conversation, right? Where the look on my face prevents the curiosity or the check-in. Because yeah, we want to be intimate with people, but we have to be safe in order for that to happen.
Mm-hmm. Definitely. Let's go to, so what's the bottom line? Basically, the bottom line is every person's right. It's everyone's right to identify however they wish to identify themselves. And that may be fluid, it may change, it may be flux. Others and the people around us, they deserve and need our respect with who that person is. Even if that person's identity doesn't make sense to you or to them or whoever, respecting that. Respecting, even if it's a mystery and unknown even to them, respecting that. So I think really respecting others and just being open and curious. I think we've done a good job of talking about some of those things, and that's really what it's about.
Yeah,
Definitely.
for sure.
So there's some resources there that you can see. I just wanted to give you some resources. Remember, we do base this on some evidence. I told you earlier we had the World Health Organization for the rights and some other resources, but these are some other really good places. If you're like, I want to learn more, I want to understand more, PFLAG is a place to go, the Trevor Project, WPATH, for especially for understanding some of the trans world. The Human Rights Center as well, hrc.org. And then if you're looking for a provider, we always try to let you know you can always go to ASECT and hit the find a provider and find someone in your area as well. We did have this question that I thought was a good one, Alicia, that came in. So many people carry shame around sexuality from early experiences of cultural conditioning. We actually had an episode on purity movement. And what are some of the gentle first steps towards releasing that shame and reclaiming sexual agency? I thought that was a good question.
That's an excellent question. And I live in the middle of the country. I always say I'm doing Bible Belt sex therapy. And so every person, regardless of their background, right, can have an experience of shame. But certainly there are particular kinds of experiences that might make that more amplified. And I love the question, which is, what's the entry point? It's a recognition that, this isn't necessarily something that has to be solved all at once, or there's one like cure-all that's going to get us through that. And we've talked a lot about curiosity today. And I think curiosity opens the door for some gentleness, some openness. The other part of that question was about like connecting with some sexual kind of expression or experience, and finding safe partners, having friends and loved ones in your life that you can start to talk about these things with, recognizing that shame is often a self-protective experience. It's an emotion that's meant to keep us safe, right? It's a little bit like, don't touch the stove because it's hot. Like, don't do something that might get you in trouble or excluded from the group. So developing a sense of self, of esteem, right? You talked about Brene Brown, and she talks about self-esteem as not, oh, I love myself so much, I think I'm so great, but it's really, I esteem myself. I am a person worthy of care, of attention, right? Of love, of affection. And some of those things help really combat the experience of internalized shame.
Definitely. And I think working with a therapist, and again, I love some of Brene Brown's, I love her work. And so I started with The Gifts of Imperfection, but I think you could start with wherever you'd like, but I found that a good place to start. It has the 10 guideposts to wholehearted living and really kind of starts you into shame. But I think there's some really good books out there. especially Brené's work, as well as, like you said, just maybe tapping into a professional who could help you as well.
Right.
Um,
Kristen Neff writes about self-compassion, and
well,
I think her books are really excellent as well, just in practicing. I went to a conference over the weekend and we talked a lot about the rise of technology, the polarization, political and otherwise, that we're all experiencing. And the ways that these things have caused us to go a little bit inward and self-protective. And,
mhm.
somebody said at the conference, I thought this was such a good saying. They said, why talk to other people when you can just talk to yourself? And basically, pornography, Facebook algorithms, right? AI, ChatGPT, these are all kind of ways of talking to ourselves because we keep teaching it what we want to see. And then it shows us more of that, which in some ways can be really useful. There are a lot of things that we can learn from these experiences, but the way that we're being negatively impacted is it's making us more averse to being vulnerable. We don't want things that we don't know how they're going to go, that we don't control, that we don't get to predict, right? It's why we see some of the hostility on the internet, right? With people arguing with each other instead of like, oh, I never thought about it that way. Tell me more about your perspective. Instead, it's like, you're a so-and-so, right? For thinking that.
Right.
And I think related to the shame piece, there's a little bit of that, just like willingness to be vulnerable,
Yeah.
right? To step into, this was a behavior that I developed to be included in my in-group or to try and not be rejected, right? Or to feel safe in the world. And as I grow older, maybe I need those defenses a little less. And
Mm-hmm.
how can I, be more gentle, soften up around myself, learn to find some vulnerability.
I tell my vets all the time, it takes a real hero to be vulnerable.
Yeah.
It really does. Vulnerability is scary, but it's the only path to love and creativity and joy and all the and bliss and the things that we want in our lives. And I
Right.
so get that it's the path to sadness and heartbreak. But
Sure.
sometimes out of that heartbreak comes the joy too. We had another question as well. How do societal norms and media representations help or hinder authentic expression in intimate relationships for gender diverse individuals? And we could do a whole podcast.
Right. Right. That's a huge question. It's a great question.
Definitely. So
Um,
I think
Go
there's so
ahead.
many ways. No, there's just so many ways that it does. I think you think about what you were conditioned with growing up with the different shows. So think of, depending on your generation, maybe it was I Love Lucy, Leave It to Beaver, or whatever, or the Brady Bunch, or whoever. But there's
Right.
ways that we have experienced what genders are, what they should
Sure.
be, what they shouldn't be. I think there's many influences, but I'd like to hear more about what you have to say about it, Alicia.
You know, um, what came to mind was particularly in the sexual expression sort of landscape around, we have these ideas that people with penises like these kinds of behaviors, right? People with penises like them to be called penises, which isn't always the truth, right? People with vaginas or vulvas like to be interacted with this in this particular way. And I say, that's not true. Even cisgendered people who identify gender-wise along with their, in alignment with their identified sex at birth, don't always like their sexual expression to look a very prescriptive way. The number of times in my career that I've had people come in and say, well, every, partner I've ever had loves it when I, squeeze their nipple like this or touch them in this way. And I'm like, well, a lot of people like sushi. It doesn't mean I want to eat it. Like, you need to ask the person that you're with. And so one of the things that I love about this season of human history, because it's really complex and there are a lot of problematic things, but is the familiarity, the comfort with which we see people in all manner of dress and all manner of presentation. Now, depending on where you live, that may or may not be as accessible in your area, but certainly in media, in music expression, right? We're seeing more of this. So in that way, I think it has helped normalize.
Mm-hmm.
There was a really interesting podcast that broke down marriage equality and how it pulled for years and years the passing of, legalization of gay marriage and the Marriage Equality Act. And you can directly link the passage of the Marriage Equality Act to the run of Will and Grace television show. That the longer the show was on, the more statistically acceptable, right, gay marriage became, until it finally got to the threshold where it was able to become a law. And so we see that representation is very important. Seeing people, having a familiarization, understanding that the way someone dresses doesn't necessarily align with how they see their gender, who they like to have sex with, if they want to have sex with anybody. So I think that that's an excellent question, because there are certainly still some stereotypical reinforcements, but I think there are a lot more kind of open, diverse, fluid expressions than we've ever seen historically, right? And that can be really useful for people. They want to be seen.
It's to be seen, heard, and valued. And then you're
Yeah.
looking at these things to be like, where am I on there? Where am I
Right.
in the Brady Bunch? Where am I in the whatever thing?
Right.
So I think that that's really so true. And we all desperately need love and belonging, to feel like we belong. So I think it's so good that we're finally starting to see the diversity in different people, and hopefully people seeing themselves in those things.
I was looking because, I have on my shelf here books that were written by various of my friends and colleagues. And for example, Ray McDaniel, who wrote this Gender Magic, my friend Lucy Fielding, I don't have it here right now, I had it here last month, wrote a book called Trans Sex. And, they're both these opportunities for us to get out of, that's why I said people who have penises or people who have vulvas and vaginas, that some people want the way their genitals are referred to be more in alignment with their gender identity, or the actions that we talk about or take to be more in alignment with how they see their gender identity. So certain kinds of sexual terminology might feel more gendered to them in a way that doesn't align. So all of these are opportunities, right, to see people differently, and then to just be curious about what feels right to you. What do you like?
And being open and understanding creates more love and kindness. And what more could we need in the world today is more love and kindness. So
That's exactly right.
Let's all spread a little more. That kindness movement is a big deal. Let's all be a part of that kindness and love. I have a little sticky in my closet that says, reminds me that my intentions are to bring more love, kindness, and into the world each day. And that doesn't change no matter what's going on, the craziness around you. What I'm trying to do every day doesn't change. We can all do more of that.
Sure.
I'm going to do this quick centering exercise, and then I'll come right back to you and we'll finish up. But this has been a lot, maybe for some of you. Maybe for some of you, it's just been somewhat of a review. But let's just take a moment to pause. Let's take a moment to pause and breathe. If you're with your partner, cuddle up in a comfortable way for both of you. If you're alone, get into a comfortable position and gently close your eyes. Relax your hands wherever they're comfortable. If that feels safe for you to close your eyes, do so. Take a slow, steady breath in. Several counts in. And then exhale slowly and gently. Fall into this deep, slow pattern of breathing where you inhale slowly and you exhale slowly and gently. Let your body soften. Let your shoulders drop. Oh, I love to hold tension in my jaw. Let it go, let it go. Let go of that jaw tension. Unclench. Release any unwanted tension in your body, in your back, in your abdomen, in your pelvic floor, in your thighs. Release what isn't here to serve you right now. Any tension. Now allow yourself to arrive fully in this moment. Now gently repeat to yourself, either silently or aloud, I honor the truth of who I am. I open my heart to understanding and connection. There is space for all of me and all of you here. That's the beauty of it all. I am worthy of love and belonging. I am enough. Take one more deep breath in and release. When you're ready, gently open your eyes and carry forward this sense of openness, curiosity, compassion. Carry it into your life as you move forward. It has, Alicia, I am just amazed you jumped in, and it was so great to have you here. I am just so honored and so blessed to have you on this episode. Gosh, your experience, all of the things you brought to it, it was just perfect. And I know Lisa, who couldn't be here this evening, Lisa Katona, also appreciates it as well. I am just thrilled with the things that we were able to explore this evening. And thank you so much for being here.
Thank you so much for having me. It was a lovely conversation. I'm sure Lisa will join you soon. And, I hope everyone gets something useful out of our conversation. That's what we're here to do.
Definitely. Vic, what's up next week? Let's give them a sneak preview real quick.
In this powerful and informative episode, nurse practitioner Kate Arima joins Dr. Jeff Albaugh. Kate shares the research-based yoga program she designed specifically for men recovering from prostate cancer treatment who are dealing with incontinence. Kate's unique approach combines her deep understanding of men's health with the healing potential of yoga. Learn how yoga and pelvic floor techniques can help support urinary continence and sexual function, based on evidence-backed practices. Whether you're a survivor, caregiver, or clinician, you'll walk away with practical tips and yoga techniques to improve quality of life after prostate cancer. Join us Tuesday, May 6th at 7 p.m. Central Time to learn more.
And Kate did tell me that this will be directed at both men and women. She does, she primarily works with women, but she developed this program because the men needed a program too. So she's going to have something for everybody on yoga and the pelvic floor. I'm really excited because she's going to teach us some very specific things, and it should be great. Oh gosh, Alicia, thank you so much. Vic is amazing behind the scenes. Thank you, Vic. And thank you to each of you for joining us. We are so honored that you took time to be with us. I hope it was helpful, and have a great evening.
Take care.